Hi, my name's Lina Martino. I'm a consultant in public health and chair of the Faculty of Public Health Special Interest Group in Public Mental Health. We know that over the last year the coronavirus pandemic has had significant impacts on individuals, families and communities, and that it's exposed and widened existing inequalities in health, including mental health and well-being. Now, this is both through direct effects of the virus, including illness or bereavement, and also the economic and social impacts of the control measures taken, such as unemployment, social isolation, and particularly for children and young people, disruption to education. And while many of these issues aren't necessarily new challenges for public mental health, they do present additional challenges in areas where there have been long-standing and persistent inequalities. We know, for example, that there have been disproportionate effects on people from Black, Asian and minority ethnic communities, on women and on disabled people, including people with a learning disability or autism, and also on inclusion health groups such as those who are homeless or have no recourse to public funds. And what this means is that where people have been at greater risk of poor mental health due to systemic disadvantage or the circumstances that they live in, these risks have been increased, and where they've been less likely to be able to access support, there are now even more barriers. And it's not just about mental health services either, but about general health services, wider public services and community facilities, social networks and support. So in other words, all of the things that help people to recover and to stay well. And crucially, it's also reduced the number of contact points across the whole system. So it's now harder to intervene early when someone needs help or to recognise where there are safeguarding concerns. Now, one positive for public health has been the increased focus on health inequalities and increased awareness of these issues. And we have talked a lot about the pandemic affecting health through changing or unequal impacts on access to green space, physical activity, healthy food, housing, and disruption to education, employment and health services. But it's really important to remember that this all includes mental health. And the things that affect our physical health are also the things that affect our mental health. The two aren't mutually exclusive, they do interact. And one of our key priorities then should be to ensure that consideration of mental health and well-being is embedded in longer term recovery and restoration plans post-COVID. And in developing those plans, it's important that we don't just think about dealing with the negative after effects of the pandemic, but also how it's shaped the way that we work, the way we communicate, and how we participate in society. As we move towards a new normal, the online environment is becoming a bigger part of our lives and also of service delivery. So there's a very real risk that those who've already been excluded or marginalised are going to be left further behind. So it's essential that they're included, involved in these plans, and that we actively seek to address these inequalities. So as we hopefully start to move towards a post-COVID era, there are two key things that we need to remember as advocates of public mental health. Firstly, that there is no health without mental health, and therefore no public health without public mental health. And secondly, that as we build our new normal, everyone should benefit and nobody should be left behind. Thank you for listening.